Hello, and welcome to our online presentation of Knee School. My name is Wendy Ciperni, and I'm the Bundled Care Coordinator here at Southlake. During today's presentation, we will be reviewing the following: what to expect before, during, and after your surgery, what you will need to do to prepare for and recover after your surgery, how to care for your new joint, and how to plan for your discharge home. You will hear today from members of our team consisting of nursing, physiotherapy, and occupational therapy. They will be reviewing inpatient and outpatient expectations, as well as demonstrating exercises and equipment that you will be required to have arranged prior to surgery in order for you to have a successful outcome. Along your journey for your planned knee replacement surgery, you may hear the term bundled care. It is the term given to the funding that Southlake receives from the Ministry of Health to provide you with your joint replacement surgery. In April of 2018, we became a pilot project for this funding formula along with 7 other hospitals in the province. In April of 2019, every hospital in Ontario fell under this funding model for joint replacement surgeries. As the coordinator for the program, I am the dedicated patient resource to support patients and caregivers. My contact information is included in this presentation. Please feel free to contact me with any questions or concerns you may have along the way. As this is a planned surgery, there is an expectation from a patient perspective for you to have all of your plans in place before your surgery moves forward. There have been many changes over the past couple of years for anyone that has had a previous joint replacement surgery or knows someone who has. These educational sessions are provided to our patients so they are aware of all of the changes that have come about. One of the biggest changes is that there are no further in-home assistance or inpatient rehab treatment available to post-op patients in the province of Ontario. The Ministry of Health has clawed back the funding for this. You may have received these services in the past after surgery, but unfortunately, you do not qualify for them now. If you are currently on service with LIN, you will need to touch base with your LIN coordinator to discuss your treatment plans. You must have a dedicated coach to stay with you for at least 1 week after your surgery. It can be your spouse, extended family, or a friend. It does not have to be someone to watch over you 24/7, but they should be available to check on you regularly after you leave the hospital and perhaps help you with your household chores, monitor your pain control, and encourage you to do your exercises. We realize that this is a surgical procedure, and if you do not have a support person at home or an appropriate alternate plan, your surgery will be deferred, as it is unsafe for the surgeon to move forward. This surgery is life-altering, but not life-threatening, so there is time for you to plan for a successful outcome. You will be discharged the day following your surgery, or possibly the day of surgery, if you have discussed that with your surgeon, as long as you are medically stable and you have met your discharge criteria from a physio perspective. You will need to make arrangements for someone to take you home once you have been cleared for discharge by the team. If you live alone, have no family support or social supports when going home, or would like some supportive care following your hospital stay, many local retirement homes offer respite care for a short-term stay. Arrangements for this private service need to be made in advance of your admission to hospital, as there is paperwork that needs to be filled in by your family physician, as well as a chest x-ray to ensure that you are not bringing something communicable into the full-time residence. Your discharge date will not be delayed if a prearranged respite bed is not available on your day of discharge. Please be aware that discharges do occur on weekends and plan for this accordingly. During your stay at respite, services provided may include 24/7 supervised care with an emergency call system, assistance with bathing and showering, daily housekeeping, and meals. Be aware that some facilities may have a minimum stay requirement and that you will be required to cover all the costs for your stay and transportation to and from the facility and to any scheduled appointments while you are there. I will also be the person to help you organize your outpatient physiotherapy if needed. We have partner clinics throughout the province of Ontario that will be available for you to attend if you are unable to attend Southlake, that will provide your treatment, and Southlake will cover the cost, but only at approved clinics, not at all clinics. Knee physio is generally twice a week for approximately 6 weeks following best practice guidelines, and your initial appointment will be approximately 7 to 10 days after surgery, but you will have exercises upon discharge from the hospital to do in the interim. If you choose to continue your physio treatment with a private clinic that you may have attended previously, you will be responsible to utilize your private health benefits or pay out of pocket for these sessions. We understand that you may have a level of trust developed with your physiotherapist, and those are important relationships to continue if you choose. You will not be allowed to drive yourself to these appointments until cleared by your surgeon to do so. If you are not able to arrange transportation, there are options within the community, for example, chats, YRT Mobility, which is an application that takes about 4 to 6 weeks to process, taxi, or Uber. We have been asked by the Ministry of Health to have patients fill in a survey labeled PROMS, which stands for Patient Reported Outcome Measures. This survey will let your healthcare team know how you're feeling and doing. We would ask that you complete your PROMs after today's educational session, as well as 3 to 5 months post-op and 1 year post-op. You will receive an email, if you have consented for electronic communication, with the information on how to log on with the link, as well as reminders along the way at the 3 to 5 month mark and the 1 year mark. You will now hear from our charge nurse on MSK, followed by one of our physiotherapists, and then our occupational therapist rounds out our presentation. We appreciate your time today, and I will follow up with you prior to your surgery in order to make sure that you have all of your plans in place for a successful outcome. If you have any questions or concerns, please don't hesitate to contact me. Thank you.
Welcome to Southlake Regional Health Center Knee School, preparation for total knee arthroplasty surgery. Remember to attend all appointments. You may have several appointments to attend prior to your surgery. Primary care provider, the pre-operative clinic at Southlake, in anesthesia and nursing, specialist appointments as indicated, lab for pre-operative blood work. For all appointments, please be sure to bring your health card, medication list, bring any paperwork provided by your surgeon's office, bring your guide to total knee replacement surgery booklet, and arrive on time. Preparing for your surgery. Remember to practice the strategies and exercises that are outlined in your guide to total knee replacement surgery, given to you at the prehab education session at the Total Joint Solutions. Maintain a healthy, well-balanced diet at home. We strongly urge that you maintain a healthy weight prior to your joint replacement surgery to minimize risks of infection. If you smoke or use smokeless tobacco, we strongly encourage that you stop at least 2 to 3 weeks prior or more before your total joint replacement surgery. You're going to require a designated coach. Before your surgery, you will be required to designate someone to be your coach. Your coach should be identified by now. The role of your coach is an important one. This person will support you as you prepare for and recover from surgery, keep you motivated, assist you with your exercises, and remind you of your post-operative precautions. If you live alone, you will need to make arrangements so that your coach, friend, or family is staying with you. We recommend for someone to stay with you at least 1 week upon discharge. Your preoperative appointments. Prior to your surgery, you will be booked for an appointment at the preoperative clinic at Southlake. You will be seen by a nurse, a pharmacist, and an anesthesiologist. Please bring at least a list of medications from your pharmacy, your medications including prescriptions, over-the-counter, herbals, vitamins, puffers, eye drops, and or creams. The completed preoperative history and physical exam form filled out by your primary care provider and your guide to total knee replacement surgery. Medications to stop prior to surgery. Some medications that you currently take may prove harmful during surgery because they thin your blood and increase the risk of bleeding after surgery. Others may contribute to complications, and we may ask that you not take them in the days prior to your surgery. Following the recommendations that your health team will provide, in pre-operative clinic. They will guide you as to which medications to stop before your surgery and which ones to take the day of your surgery. 3 days before your surgery. Perform the preoperative wash using sponges provided in pre-op clinic according to directions given. Begin using the preoperative sponges 3 days before your scheduled surgery. For example, if your surgery is scheduled for Friday, you would start using the sponges on Tuesday. It is best to apply the sponges in the morning or evening after a shower or bath. The night before your surgery. Unless otherwise instructed by your surgeon, follow the instructions given to you in pre-op clinic regarding eating and drinking. Apple juice, black coffee, or tea is now permitted as instructed. Please refrain from smoking the morning of surgery. Do not wear makeup or nail polish. Shower the morning of surgery if possible. Day of surgery. Arriving at the hospital. Your surgeon's office will instruct you on your expected arrival time. Upon arrival, check in at the Welcome Center at the East Main entrance. Preparation for your surgery. Application of ID armband. Change into hospital gown. Your belongings will be placed into a bag with your name on it. Nurses will review your medical records, take your vital signs, perform a brief exam, start your IV, and arrange for any outstanding tests. Visit from anesthesia. Spinal or general anesthesia will be administered. An IV antibiotic will be started. What to expect after your surgery. Following your surgery, you will be admitted to a bed. Frequent nursing assessments and checking vital signs. Numbness to both legs and feet from your anesthetic is normal. Aquacell bandage on your knee may be covered with a tensor bandage and another soft roll bandage as well. Deep breathing and coughing as well as ankle pumping are encouraged. New and previous medications will be provided as well as IV antibiotics. Sitting at the bedside on a chair or toilet the day of your surgery. Physio and OT, occupational therapy, evaluations and treatment. A catheter may be inserted if you are unable to empty your bladder after 4 to 6 hours. Your bladder will be empty better if sitting or standing, especially for men. There is a possibility that your roommate may be the opposite sex. Staff will ensure your privacy during your care. Incision and dressing. Your dressing will remain in place for 2 to 3 weeks until you follow up with your surgeon. You may shower, but avoid immersing your dressing, example swimming or taking a bath. It is normal to see blood and condensation in your dressing. Contact your surgeon if your dressing is draining or is completely saturated with blood or fluid. There is a possibility of reddish pink colored area around your dressing. Check to see if it is the antiseptic that's used, which is a pink in color, and if it wipes off with a damp cloth and is able to be removed, then there's nothing to worry about. To reduce the risk of infection, avoid touching your dressing. Staples will be removed at approximately 2 to 3 weeks in the fracture clinic unless otherwise directed by your surgeon. Pain control. Staff will ask you to rate your pain between 0 and 10. You'll hear this many times during your stay between nursing staff, physio, occupational therapy, physicians, the pain nurse. You'll be asked this question several times. 0 means no pain, and 10 is the worst pain you've ever had in your life. We don't expect anybody to be at a 0, and we don't want anybody at a 10. The ideal rate of pain would be between 4 and 5. This enables you to still perform your exercises, get up, move around, go to the bathroom. Anything beyond 5 gets a little bit more difficult. So we encourage that you let us know if your pain gets above a 5 so that we can take care of that pain and make sure that your pain is well controlled so that you are able to move. Pain will be controlled by medications taken by mouth and through an infusion of medications applied under the skin directly to the nerves, affecting the front of your knee. Taking pain medication as ordered will allow you to participate better in your recovery. Please ask for pain medication as needed. Pain is normal and is not expected to be rated at a 0 when in the hospital. Our goal will be for your pain to rate no more than 5 out of 10 at rest. Pain will worsen when you are moving, though it is necessary to move. We tell our total joint replacement patients that they should expect to be able to move, and the more they move, the better it is. We tell our patients that it's like buying a new pair of shoes. The better you wear them in, the better they're going to fit. If you don't wear them in properly right from the beginning, they're not going to fit right all along. Medications. While in hospital, you will receive your usual medications, which are confirmed with our pharmacist. Pain medication, laxatives, because of the narcotics that we give you for pain can cause constipation, and blood thinners. Your medications will be reviewed with you upon discharge. When at home, speak to your pharmacist or for medication recommendations specific to you. Extend release Tylenol, example Tylenol for arthritis, should be taken every 8 hours, and your prescribed narcotic medication only as needed. Narcotics are constipating, so be sure to consume adequate fluids and high fiber diet to ensure regular bowel movements. We ask that you don't let yourself go more than a couple of days without having a bowel movement so that it doesn't become too difficult and create another problem for you. The pain medication that was provided directly to the nerves of your knee will wear off, and you will require to use your prescribed medications to control your pain. Confusion after surgery. Some patients may experience confusion after surgery. If you or your family feel you are experiencing confusion or hallucinations, inform the healthcare team. Ensure adequate fluid intake, which helps to flush a lot of the medications given during the surgery out. Manage your pain. Pain can also cause delirium and confusion. And have a family member or friend stay with you. Your family and your friends know you better than us, so they should let us know if they notice anything, as well as yourself, of any change in personality. For post-op day 1, the day or after your surgery, you'll have lab work if ordered by your physician. You'll have an x-ray of your new joint. The physical and occupational therapy will work with you in gait training, how to safely use a walking aid, stair training, exercise and education to care for your new joint, review of activities of daily living. Coaches are encouraged to attend physio and occupational therapy sessions, and then you will be discharged home. Post-op day 1, the day of or after your surgery. Prior to your discharge, you will get in and out of bed, walk to the bathroom, get up and down from a chair or toilet, walk a short distance with a walking aid, perform practicing stairs, and review your exercises for home. Recovering at home. Pain, bruising, and swelling are very normal. You've just had surgery, so those all should be expected after having surgery. Managing swelling, you can use ice on your operative knee for 10 to 15 minutes every 2 hours. Avoid direct contact on your skin. So we ask that you put either your tensor bandage back on your knee before applying the ice or a towel. Continue for up to 10 days and as needed afterwards. Elevate your leg on 2 pillows for 15 to 30 minutes, 3 to 4 times per day, and pump your ankle up and down to help relieve swelling in your leg. Diet. Appetite is often reduced because of the medications that we're giving. Eat a balanced diet, healthy diet, and rest as needed. Recovering at home, sleep. Patients report that sleep is often disrupted for a number of weeks following surgery due to many factors including pain, discomfort, and medication use. You may sleep in any position that is comfortable. Do not sleep with a pillow directly under your knee where the knee is bent. This can create some blood clots and it can stop your knee from bending properly going forward. You may place a pillow between your knees if you sleep on your side.
Welcome to the physical therapy section of Knee School. The information found in this section will help you throughout your surgical journey. On slide 28, we have a healthy knee joint. A healthy knee joint is one that is formed by the femur or the thigh bone, which is the top bone in the figure, and it sits atop of the shin bone or the tibia. In the middle of the diagram, you'll notice a triangular shaped bone known as the patella, or more commonly known as the kneecap. The white ends of the thigh bone or femur demonstrates cartilage. And the top of the shin bone, you can see two horseshoe-shaped structures known as cartilage. It's a specific type of cartilage known as meniscus. This cartilage acts to help cushion the knee during activities of daily living, as well as helps the knee bend and straighten smoothly. On slide 29, you'll notice an arthritic knee joint. An arthritic knee joint is one in which the smooth cartilage, the meniscus, and the cartilage at the end of the thigh bone has been disrupted or is worn away. And that results in a knee that is painful and doesn't function quite like it once did. With this lack of function, one will notice reduced strength and flexibility throughout the knee joint, and certainly muscle weakness throughout the knee joint and other surrounding musculature. Your physician or your surgeon will be looking at your x-rays, and as you can see with the diagram on the right of your screen, there is a wearing away or an obliteration of that spacing that you can see between the two bones. When that spacing is eliminated on x-ray, one can be very confident that the knee has an arthritic process that has taken place and is no longer houses the healthy cartilage that was once there in the past. On page 30, we describe what occurs when one has a total knee replacement. So what does occur is the weight-bearing surface of the bone, in this case the thigh bone and the shin bone, are replaced with a metal surfacing. And in some cases, the back or posterior side of the kneecap is also replaced, and that's by placing a plastic button in behind there. In between the two bones of the thigh bone and the shin bone is a plastic component that exists between the two new metal layers. On slide 31, you'll see the title partial knee replacement. A partial knee replacement is also known as an Oxford knee replacement or a hemiarthroplasty. In this situation, the medial or inside portion of the knee is replaced both on the thigh bone and the shin bone with a metallic or a metal component, as well as a plastic spacer between the two metal components. This type of surgery is reserved for those folks whose arthritic changes only have occurred on the inside or the medial portion of the knee. The benefits of this surgery is that it only replaces the portion of the knee that has become arthritic, and it could be converted later to a total knee arthroplasty should the patient require. On page 32, the title, bilateral knee replacement. In some situations, patients have severe arthritis in both knees, and through discussions with your surgeon, they may offer you the opportunity to have both knees replaced at the same time. In this circumstance, it is imperative that your exercises be performed on both knees, both prior to surgery and after surgery. In some cases, because both knees have been replaced, patients may require an additional night at the hospital, but this is not always the case. Slide 33. When receiving physical therapy at Southlake Regional Health Center, prior to your appointment, we want you to continue to perform the exercises that your therapist in the hospital provided to you. We encourage you to take your pain medication as needed prior to exercising. And you must remember that your recovery is dependent upon the effort that you put in. We recommend you continue to use the walking aid that you were advised to utilize in hospital. And when you come for your outpatient physical therapy appointments, your therapist at that time will advise you on how to best progress your walking aid. I'd like to take this time to discuss walking aids. For those who are having knee replacement, most often it is the case that your weight-bearing status and which indicates the permissible amount of weight that you can place through the leg after surgery, is typically indicated as tolerated. This is a decision that your surgeon makes and informs the staff after surgery. If you are deemed weight-bearing as tolerated, you may use a variety of walking aids. The most common include a rollator walker, which is a walker with 4 wheels, 2 brakes, and a seat. You may also use crutches. It is likely that we will start the process of walking with what is called a 2-wheeled walker. This is a standard walking frame with 2 front wheels. This walking aid can be used for the first few days after surgery, but oftentimes will require progression within the first week to an additional walking aid. It is our recommendation that you go out to family and friends and make a request to see if they have a walking aid in the home that they are no longer using. No matter what, you can always rent the appropriate walking aid, and that will be deemed by your physical therapist the day after your surgery and prior to your discharge home. We certainly encourage that you arrange your outpatient physical therapy prior to your surgery. If you're having any difficulty with arranging physical therapy, please contact the Pathway Administrator here at Southlake at 905-895-4521, extension 6549. Outpatient physical therapy at Southlake typically is provided in group therapy classes twice a week for 1 hour for approximately 6 weeks. However, at this time, due to restrictions put in place by the COVID virus, it may be arranged on a one-on-one basis and through telecommunications such as a laptop or a tablet. On page 34, Physical Therapy at Southlake, we want to encourage you to only perform the exercises that you were provided by your therapist after surgery. Adding in additional exercises that weren't prescribed can have a negative impact on your knee. What we want to stress is that it is extremely important to regain the movement, or what we normally refer to as range of motion, which simply refers to your ability to straighten and bend your knee. It is of extreme importance that you regain this motion, straightening and bending the knee to your maximum capability within the first 6 weeks. Unfortunately, after 3 months, your ability to change your current range of motion or movement in the knee will be very, very limited, as the scar tissue will have matured at that point in time. What we therefore recommend is that you prescribe an appropriate amount of time during your recovery to perform your exercises routinely throughout the day. This will be reviewed with you by your physical therapist prior to your discharge. And these exercises can and will be modified by your outpatient physical therapist. If you choose not to attend therapy at Southlake, we'd ask that you contact our pathway administrator for information about clinics that have partnered with Southlake to provide you therapy closer to your home. The number is, again, 905-895-4521, extension 6549. We do encourage that you practice your exercises provided in your package prior to your surgery, as doing so will ensure that the technique and the ease of performing those exercises is improved following your total knee surgery.
Occupational therapy. The role of the occupational therapist is to promote your independence in daily activities after your surgery and to make suggestions for home safety. Our expectation is that you take the time to make your home safe, rent or purchase your equipment, and arrange the support that you will need upon discharge. The purpose of this presentation is to help you prepare for your hospital stay and your return home afterwards. Your stay in the hospital is brief. You may be leaving the same day as your surgery or the following day. Please scan this list for items that you may want to bring to the hospital. Please label your belongings, and when packing clothing and footwear, keep in mind that you can expect some swelling after surgery, so it would be a good idea to bring clothes that are loose and comfortable. You may want to consider bringing some ginger ale, paper, pen, and your walker and your crutches. The physical therapist can take a look at your walker and crutches and size them according to your needs. We do not suggest that you bring any valuables or large sums of money, as we do not have anywhere where we can lock your belongings. Since you are coming in for a planned surgery, you must take the opportunity now to prepare and ensure that your home is set up safely. You need to make sure that railings are secured. You will likely be going home using a walker, so ensure that you have space in doorways and around furniture to navigate a walker. We are always concerned about risk of falling as you recover, so please remove clutter, any tripping hazards, and consider storing commonly used items between shoulder and hip level, as well as lighting your pathway from the bedroom to the bathroom. It is important that you consider where you will sit at home. Here's a picture of someone's home. Notice that electrical cords are out of the way and that scatter rugs are removed to reduce tripping hazards. Notice that a cushion has been added to a low seat to raise the height of the chair. You can also obtain chair blocks that fit underneath the legs of the chair that can raise chairs. Notice that the person is wearing supportive footwear. Think about keeping items that you need within easy reach. Consider wearing a fanny pack to transport necessary items like a cell phone, your medication, and contact numbers, as we expect that both of your hands will be on the walker. Your stay in the hospital is brief, and your recovery will continue once you're home. The initial focus of your energy, once home, will be on managing your personal care and on your therapy. Consider preparing meals in advance or stocking up on frozen meals. Make sure that you arrange assistance for heavy household duties like lawn care, laundry, changing the bed, and vacuuming. You will require someone to drive you to your therapy appointments. Please arrange for your equipment prior to your surgery. You should have a designated, supportive family member or friend stay with you for at least a week once home. It may be helpful to have someone close by when you begin showering. If you live alone and do not have anybody that can stay with you while you recover, you may consider respite care. If you do consider staying in respite care, you do need to make arrangements prior to your surgery. Your family physician will need to fill out appropriate paperwork, and you will require a chest x-ray. There is a fee associated with respite care. The fee covers accommodation, your meals, on-site emergency response, as well as assistance with bathing once a week and cleaning your room. Should you require any additional assistance, for example, transportation to your meals or more help around your self-care, that can be provided at an extra cost. Please contact the Pathway Administrator for further information at the number listed on the slide. It is important that you arrange for someone to drive you home at any time during the day that you are discharged. Ensure that you have a vehicle that you can easily get in and out of. We discourage you from getting into a low vehicle. In order to get into the vehicle safely, your occupational therapist will demonstrate the proper technique with you. If you do have a long trip, make sure that you're pumping your ankles and that you're taking breaks every hour, getting out of the vehicle and walking for a short distance. You are responsible for renting or purchasing equipment from a home medical supplier or borrowing equipment from family and friends prior to your surgery. With regards to bathroom safety equipment, you will require a raised toilet seat and separate toilet rails or a height adjustable commode seat to ensure that your hips are higher than your knees when sitting on the toilet. If you're in a multi-level home, you should consider one set of equipment for each floor. You will also need to obtain long-handled dressing aids such as a reacher, shoehorn, and sock aid for lower body dressing. Please ensure that you have a walker, whether it's a two-wheeled walker or a rollator walker, as well as a cane. Optional equipment for going home include a wedge cushion that you can easily put on a chair or transport with you, chair or bed blocks that can increase the height of a chair or a bed, as well as grab bars in your bathroom. If you are getting grab bars, please ensure that you're having these professionally installed. Here's a picture of a bathroom that has equipment in place. If you look to the right, you'll see that a commode chair has been placed over the toilet. There is a tub transfer bench over the tub, and this will allow you to sit at the edge of the bench and slide your legs in. There's a handheld shower installed that will make bathing easier, as well as grab bars. If you are going to be using a bath mat, we recommend that you use one that has a rubber bottom to it. Otherwise, remove your bath mat completely. You will have activity restrictions after your surgery. Please scan this list below for activities that you should consult your surgeon about prior to engaging in. Please complete the following prior to your surgery. Obtain a medication check from your pharmacy. Obtain and practice use of your reaching aids and your walking aids. Obtain and install all necessary equipment prior to your surgery. Identify your coach. Organize for assistance at home, or arrange to have family stay with you, or make plans for respite care. Ensure that your home is prepared. So for example, remove your scatter rugs, make sure you have your railings installed. Make sure that you arrange for your transportation. You will need transportation to drive you the day of your surgery, as well as to pick you up at any time of the day of your discharge. Become familiar with the exercises prior to your surgery, and also ensure that your therapy appointment has been arranged. If you have any questions about your care journey, please contact our Pathway Administrator at the number listed on the slide. The following websites offer additional information that you can refer to prior to your surgery. Good luck with your surgery, and we look forward to meeting you soon.